hello. So most of the people I do this with are busy and I cannot have anybody else to do this with. So I'm going to do it by myself. Some common history terms that you can ask for the knee is what you are in for, and they can tell you what their pain is, where their pain is located. Some of the things that you will get is I have pain in my right knee or I have pain in my left knee, either or. Another common history question you might ask is there any pain, like history pain with the history? So like, have you had previous pain before? How long has this been going on? Something like that. Another common history question is when did your pain start or your symptoms? Some people might say, oh, I'm getting like a numbness in my knee on like this side of my knee. So you'll just have to be like, well, when did it start? And they'll tell you when. Another common history question is when are your symptoms worse? So morning when they wake up, afternoon after they've been working a while, or evening when they've been tired. Another common history question is has this knee been injured before, or have you injured the other knee? Sometimes what can happen is, in my case, my cousin's dog had attacked my left knee and I ended up straining my right knee. So it caused me some more issues. The last three common history questions that you can ask is how long has the pain or symptom in question been going on for? Or I'm having pain when walking. Those are the two common symptoms that you will be told about. And then the third and final question I have is does anything relieve your symptoms? So this can be, does heating your knee give you any relief of your symptoms? Does icing it give you relief of your symptoms? Those are just common questions that you can ask that can help you narrow down what is the problem with the knee. Some common observations you will have. So you're going to make sure like whichever knee is in pain. So for me, we're going to say my left knee, and I'm just going to feel around for some swelling, any popping while you're just moving around in there. You're not moving around. You're just feeling for swelling. If there's pain to tender to palpation, any localized heat. So a lot of the times when I had problems with my knee, I had localized heat right below the patella, right where the patellar tendon is. If there's any loss of motion, so like while they're walking, if the knee is locked, if the knee is staying flexed or is more flexed than extending. And if there's any deformities. So if I put my knees up here, you can kind of see like these little grooves right here. A lot of people don't have like big grooves, so you would just have to bilaterally check and make sure that like nothing's going on in there. All nice and fluid. And so now I'm going to palpate my medial joint line and my lateral joint line, and I'm going to do the same on the other knee. So my right knee is my unaffected knee, and my left knee will be my affected knee in this one. So obviously they feel about the same, no real difference here, and you want to have that knee in like half flexion, half extension. You want to be able to get in the grooves. So if you go, here's your patella, this is your patellar tendon, and you're going to go right in the little grooves that are right off of that. The lateral side, the medial side on the right, or on the left, I'm sorry, and the lateral is this one right here, and the medial is right there. Now we're going to feel for our MCL and our PCL. So the MCL is the medial cruciate ligament, medial cochlear ligament, and your PCL is your medial cruciate, medial collateral ligament, and your posterior cruciate ligament. Your medial and lateral are medial and lateral. Your MCL. We're just MCL. So the MCL is kind of hard to find. You're going to go in that medial side again. And so right here is that medial joint line, and you're just going to go over a little bit and find it. Right there. And then you're going to find it, the same one on the other side. Right about there. And then to find your PCL, you're going to want to feel on the inside, right in this area, and just feel kind of back here in that little groove behind the patella. And we're going to do the same on the other side, kind of right about there. So right there. It's right there. That's where it is. And then the last palpation we have is your patella, so your kneecap. And then the last thing you're going to want to do is you're going to want to do knee active range of motion. So active range of motion is where you essentially are, as the athletic trainer, you are not helping the person to create that movement. They're doing it all on their own. So you will ask the patient to be relaxed, and they are currently in knee flexion. Knee extension, you're going to have them bring their toes up, straighten out the leg. And then tibial internal rotation is just, you're just going to turn with your ankle in and out, internal and external rotation. And then the same on the other leg, internal and external rotation. And you can feel it right there, right here in the tibial tuberosity. You'll feel it start to move. And that is everything.